Healthcare and policing are both big budget items in the province, and with resources always tight, our Ontario Hub editors have had their eye on some creative local approaches that could be worth a second look across the province. Joining us now for more, here's Mary Baxter, who heads our Southwestern Ontario Hub, and Jeganathan, our Ontario Hub's field producer. Welcome back, Hubmeisters. Good to see you here tonight.
Thanks for having us.
Back in the big smoke. I want to start with you because this is the Starship Enterprise that you were at the other day.
It felt like it.
Actually, it looks like it. It isn't. It's actually just a hospital. But let's play a little snippet of this documentary you did, okay? And then we'll come back and chat. Sheldon, if you would, the Humber River Hospital. Here we go.
Humber River Hospital is located in Toronto's northwest end and is the first fully digital hospital in North America. With 656 beds, the state-of-the-art hospital serves a community of more than 850,000 people. But within months of opening, the hospital had reached capacity. The idea of a centralized command center was born soon after in hopes of improving the flow of patients.
So each of these pictures tells me what needs to happen with the patient before they can go home. So this patient needs oxygen, and so we know that we need to make sure that that oxygen is set up so they can go home. Here we are in 2018 and we're over capacity. And so our expectation is that with all this technology and this change that we'll have 40 additional beds available for our patients to come.
The one thing you don't see in that picture, or in any of the others actually, is paper. This is a digital hospital, right? No paper. How does this work?
There is some paperwork, I will admit, but most of the focus is on those screens. Yeah. So you got to imagine it's kind of like air traffic control at an airport. The idea is that they want to control the flow of patients in and out. With hospitals, you get people coming in for acute illnesses, some serious life-threatening injuries as well, and that has to be treated. So the problem is, and you hear these anecdotal stories, people are always waiting for a bed to be cleared. They're waiting for an MRI or a CAT scan, and then they can get discharged. So the idea is that they can get this and see essentially across the hospital who's waiting for what do they need to move up from the emergency room up to the next floor, and then eventually get them home. So they have 22 screens. They'll eventually get some more as well, and they can monitor. One screen's dedicated to imaging and diagnostics. One is the emergency room. Then there's others where it has essentially gives you a count of how many beds are available in this room. Can we move a patient there? So they get essentially one big lens, and they can look at the whole hospital.
They had a full wall-size thing there on how to clean the rooms.
Exactly.
When to clean the rooms.
Exactly.
Does that seem like overkill?
It's not overkill because, as you heard in that promo, it's the previous model didn't work. This hospital opened up in 2015, and within months, over capacity. And so they needed to figure out how can we get this moving. And so with a year of planning, they figured out, okay, well, the biggest problem that we have is whether it's your diagnostics, the portering, people who are cleaning, they're all siloed in different parts of the hospital. So here we are trying to track down someone to, say, clean a room or move a patient, and that's valuable time being taken away from a doctor visiting a patient. And one of the biggest, the biggest results that they found are from the imaging and diagnostic department. Normally, a doctor would have to call around, call numerous extensions, and try to advocate for, you know, a CAT scan to be done or an MRI to be done. And now it's just, you just call the command center, or what happens is they have an expediter in that room, and their job is if they can see, they have alerts and there's things going around, flashing around. If they see something that says this patient's been waiting for longer than 2 hours for something, they just get on the phone or they turn around to the person behind them who's in charge of imaging and diagnostic and be like, I need this patient right now to go there.
So that's much more efficient. Much more efficient. Are other hospitals watching?
I would hope so. It's quite surprising that this is the first command center in Canada, the second in the world, only after Johns Hopkins Hospital in Baltimore. And this is what that hospital was the inspiration for this one. And as you've seen, technology is kind of changing how healthcare is being done in Canada and across the world. So I believe there should be other hospitals looking at this for sure.
We should just tell people that that segment that you did, 5-6 minutes long, aired on the program on Wednesday. That's correct. Of course, if people missed it and they want to go to the website, tvo.org, it's there forever. They can find it there. Okay, over to you now, Mary. You've got a story up on the website, tvo.org, on policing. A lot of Ontario municipalities right now are talking about law enforcement. How come?
Well, I think you mentioned it at the beginning, cost. For small rural municipalities, it can cost, between a quarter and a third of their budget. So they're looking at ways at how can they be more effective in delivering services.
Many of the municipalities, the smaller ones anyway, in the province, who find those costs too much, they outsource it to the Ontario Provincial Police. Anything wrong with that?
Well, no, there's nothing wrong with that. And actually, everyone that I talked to said the service that the OPP deliver is a good basic service. There's no issue with that. But when it comes to the smaller things, what really makes a community and have that community sense, like being able to stop in at the police station and actually talk to somebody about maybe a minor concern or something. Well, the OPP can't really deliver that now to a lot of municipalities because the municipalities simply can't afford the extra costs for something like that.
So what's the alternative?
So they've been scratching their heads about it, and a couple of areas have come up with maybe approaching their larger urban center for help to go regional, basically.
Go regional. Mm-hmm. So set up regional police forces.
Yeah.
What do proponents say about the advisability of doing that?
Well, what they really like about the idea is that they're able to get boots on the ground, actually, which is a big thing. So that they establish that presence in the community that they feel has been lacking with the OPP. And again, it's not to say that the OPP aren't doing their jobs. It's just to, kind of maybe doing that stroll down the street or something. They don't necessarily have the time to do that sort of thing anymore.
What regions have done this already?
So St. Mary's, which is a town that is close to Stratford, and Perth South, which is in between Stratford and St. Mary's, are looking to contract services from Stratford. And then down near Windsor, Amherstburg is exploring the possibility. Nothing's been decided there yet. They're still debating it.
St. Mary's, everybody knows about St. Mary's.
Stonetown.
Well, I wasn't going to say that. I was going to say Baseball Hall of Fame, of course. Canadian Baseball Hall of Fame is there. Okay, and if people want to read more about that, your piece is on the website, tvo.org. Jeyan, let's go back to you now. We want to go up north because you did a piece as well, another 5-6 minute piece on practicing medicine in Northern Ontario, trying to attract doctors to the north. So let's take a look at a snippet of that, and we'll come back and chat. Sheldon, if you would.
I work full-time here and see mostly everything. It's right in the range we want it to be.
Arlene McCory is a nurse practitioner in White River, Ontario. She cares for nearly everyone in the township of about 800 people because the community has no family physician and has been without one since 2014.
It's nice to have some peer support, the physician to, consult with at times.
With a new gold mine in production, the population is expected to climb, meaning more patients at the White River Medical Clinic. For now, the township is relying on a temporary solution.
Okay, causes of doctor shortages in the north might seem obvious, but let's go through it anyway. How come?
Well, I think for a lot of young doctors, there's a perception that there is no such thing as a work-life balance. In some small communities, frankly, you're the only doctor. You are taking care of a community of about 1,000 people, and that's the case there in White River where they don't have a doctor, but that would be the situation for them. So imagine working long hours, call times, really you don't have a break. So there's a high chance of, a burnout. Then another reason is, it's not necessarily attracting doctors, it's retaining doctors. You can have a doctor there for about a year or two, but then they're gone. And it might be just a lifestyle choice. It could be a difference between rural living and urban living. There's also factors you have to look at as for the doctor's spouses, what employment there, childcare, education. So there's a number.
You do highlight one success story, though, in the piece. You want to tell us about that?
Marathon, Ontario. It is the success story of northern rural medicine. Here's a community of about 5,000 in the mid-90s, had one doctor. And then, so they had to come together and had to really look at a few things. And it was, again, the quality of life, finances, and a support team. And so what they did was they lobbied the government to have more doctors work there. just because the province has a cap on how many doctors can work in a certain town. So they lobbied for that. They were successful in their case because they were in a healthcare crisis, and they were able to get about, I think, 7 doctors within about 8 months. And they haven't had a problem with that. And that's because there is a work-life balance. There's a team. There's no hierarchy. There is no, everyone can communicate. Everyone's any concerns, questions, or advice is all kind of seen as equal.
Great. You are apparently going to the Ontario Library Association's big gala dinner to receive the Media and Communications Award because you were, because you're wonderful. No, because you did we did a piece on this program on the importance of libraries, and you did one in Southwestern Ontario. Tell us about it.
Well, that's great. The segment aired in the fall, and you are also going to the same award and also receiving the award.
I'm going just to be in your great company because you did all the work on this. There we go.
But libraries' role has it's really been changing in recent years. And last fall we did a segment, my first production credit actually, broadcast production credit, on their changing role, and we had 3 librarians in that spoke. They were from Toronto and London and Elgin County, and spoke about how their roles are changing in the different types of areas. And the Library Association really liked what we did. And before we knew it, I guess late last year, they told us.
They did indeed. So congratulations.
Thank you.
Hope you have a grand time at the dinner. Hope we have a grand time at the dinner. We will, of course, have a grand time at the dinner. Jeyan, Mary, nice to have you back here at the Mothership. See you next time.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.